As we age, our bodies change in ways we often don't talk about, but they matter. For women over 60, even small daily habits in the bathroom can quietly affect how fresh and confident they feel. And sometimes, without realizing it, these habits can lead to embarrassing odor. This isn't about shame. It's about self-care, dignity, and staying vibrant at any age. In this video, we'll uncover 5 common bathroom habits that older women must stop right now if they want to feel fresh, clean, and confident every single day.
Before we dive deeper, don't forget to hit the subscribe button and turn on notifications. This way you won't miss our upcoming videos with more life-changing health tips. Also, share this video with friends or family who might benefit from it.
Pillar: ignoring proper intimate hygiene after 60. As women age, especially after 60, the body undergoes profound changes, hormonal shifts, thinning of the skin, and reduced natural lubrication. These changes make intimate areas more sensitive and prone to irritation, dryness, and infections. Yet, many women continue using the same bathroom habits they had in their younger years, not realizing that what once worked may now be silently harming them. One of the most common and overlooked mistakes is using harsh soaps or scented washes in the intimate area. The skin becomes thinner with age, and the natural protective barrier becomes weaker. Products with perfumes, alcohol, or antibacterial chemicals can strip away beneficial bacteria, disrupt the pH balance, and cause irritation. Ironically, this often leads to the very thing many are trying to avoid: unpleasant odor. Instead, experts recommend using warm water alone or a pH-balanced, fragrance-free cleanser specifically formulated for intimate care. This simple shift can help preserve the healthy bacteria that naturally prevent odor and infections. Another hidden danger is overwashing, believing that more cleaning means more freshness. In reality, excessive washing can make the area drier and more vulnerable to micro-tears, which allow bacteria to thrive. Washing once daily with gentle care is enough. After using the toilet, it's also important to wipe front to back to prevent bacteria from the anal area from reaching the urinary tract, which becomes more susceptible to infection with age. Neglecting to change underwear daily is another small habit with big consequences. Sweat and moisture build up, especially if synthetic fabrics are used, creating a breeding ground for bacteria. Cotton underwear allows the skin to breathe and keeps moisture under control. Even better, choosing loose-fitting styles reduces friction and irritation on delicate aging skin. There's also the matter of forgetting to stay hydrated. It might not seem connected, but dehydration concentrates the urine, making it smell stronger. Staying well hydrated helps dilute waste and maintain a neutral scent. Drinking plenty of water also improves skin elasticity and supports the body's natural detox systems, which is crucial when metabolism slows down in later years. And perhaps the most misunderstood factor: vaginal dryness. Many older women feel embarrassed to talk about it, but it's one of the leading causes of odor and discomfort. Dryness creates microabrasions that trap bacteria. Water-based vaginal moisturizers or lubricants can make a huge difference, not only for comfort, but also for maintaining a healthy, clean environment. In short, once you're past 60, intimate hygiene needs to be approached gently, with respect for the body's changing needs. The goal isn't to scrub harder, it's to protect and nourish. Proper intimate hygiene is the first, foundational step in preventing unwanted odor and maintaining dignity, freshness, and confidence every single day. Part 2. Overusing scented soaps, sprays, and deodorizing products. One of the most common bathroom habits that silently harms women over 60 is the overuse of scented hygiene products. Things like fragranced soaps, vaginal sprays, deodorizing wipes, and strong-smelling bubble baths. At first, these products may seem like they help control odor. They smell fresh, they feel clean, and they give the impression that they're making your body fresher than water and mild soap alone. But here's the truth that many women don't realize. As you age, your skin, especially in intimate areas, becomes thinner, more sensitive, and much more prone to irritation. The vaginal microbiome, the delicate balance of good bacteria that protect against infection, naturally shifts with hormonal changes during and after menopause. Using harsh or fragrance products can actually disrupt this fragile ecosystem, doing more harm than good. When these products strip away natural oils and kill healthy bacteria, the body loses its natural defense system. This often leads to dryness, itching, burning sensations, and even small micro-tears in the skin. And ironically, when the protective barrier is damaged, bad odor can increase because harmful bacteria get the chance to grow unchecked. Over time, women who frequently use scented products often notice chronic irritation, recurring infections like bacterial vaginosis or urinary tract infection, UTIs, and persistent odor despite their best efforts. It becomes a frustrating cycle. They smell something unpleasant, so they add more scented products, which irritates the skin even more, leading to stronger odor and discomfort. What's worse is that many of these over-the-counter products contain chemicals such as parabens, sulfates, and synthetic fragrances that are known irritants and hormone disruptors. In younger women, the body may tolerate them better, but for seniors, especially postmenopausal women, the skin's barrier function is weaker and the body is slower to recover from irritation. This means damage lasts longer and happens faster. So what should women over 60 do instead? First, it's important to understand that the vagina is self-cleaning. It does not need soaps or deodorizing sprays inside it. The healthiest approach is to wash the external genital area gently with lukewarm water and a fragrance-free, pH-balanced cleanser if needed, and to avoid douching or internal cleansing products entirely. Second, pay attention to your laundry detergent and fabric softeners as well. Even these can leave behind residues on underwear that irritate the skin. Choose dye-free and fragrance-free detergents, and skip fabric softeners completely for underwear. Third, if odor persists despite gentle cleansing, it may be a sign of an underlying health issue, such as an infection or hormonal imbalance. In this case, it's crucial to talk to a gynecologist or primary care provider. A quick checkup can rule out any medical problems and often provide simple treatments to fix the cause of odor, not just cover it up. Another helpful tip: keep the area dry. Moist environments encourage bacterial growth. After bathing, pat the area gently dry with a soft towel. Wearing breathable cotton underwear and avoiding tight synthetic fabrics can also help keep things dry and healthy. Finally, remember this: freshness comes from balance, not perfume. Your body was designed to maintain its own clean ecosystem. Your job is simply to support that natural balance, not scrub it away. Stopping the overuse of scented hygiene products is a small change, but it can have a powerful effect on comfort, confidence, and long-term health. It's about trusting your body's natural systems and protecting them instead of fighting against them. Part 3. Ignoring subtle signs of bladder leakage or pelvic floor weakness. As women enter their 60s and beyond, one of the most overlooked bathroom-related issues is subtle bladder leakage or pelvic floor weakness, and ignoring these early signs can silently harm both hygiene and long-term health. It often starts small, maybe a few drops of urine escape when you laugh, cough, or sneeze, or you notice a slight dampness in your underwear after walking to the bathroom. It might seem minor, and many women brush it off as just part of getting older. But here's the important truth: these are not just harmless annoyances, they are early warning signs. After menopause, the drop in estrogen levels leads to thinning of the tissues in the bladder and urethra and a weakening of pelvic floor muscles. Over time, this makes it harder for the body to fully hold in urine, especially during physical activity, sudden movements, or when the bladder is full. If these early leaks are ignored, several problems can develop. Chronic moisture near the skin can cause irritation, redness, and even sores, conditions known as incontinence-associated dermatitis. Bacteria can grow in warm, moist areas, increasing the risk of urinary tract infection, UTI, and even kidney infection if left untreated. The pelvic muscles grow weaker over time from disuse, making leaks worse and eventually harder to treat. Beyond the physical effects, leakage can also quietly harm emotional health. Many women begin to avoid social activities, travel, or even exercise because they fear an accident. This leads to isolation, anxiety, and loss of confidence, all of which are deeply damaging during a stage of life when mental and emotional wellness are just as important as physical health. But the good news is that early action can prevent these problems entirely. Here's what every woman over 60 should do. 1. Practice daily pelvic floor exercises, Kegel exercises. These simple contractions strengthen the muscles that support the bladder, uterus, and bowel. To do them, squeeze the same muscles you would use to stop urine midstream. Hold for 5 seconds, then relax for 5 seconds. Repeat 10 times, 3 times a day. Over time, this builds strength and control. 2. Maintain a healthy bathroom routine. Empty your bladder fully when you go. Don't rush. Double voiding can help. After urinating, wait 30 seconds and try again to ensure the bladder is completely empty. This reduces the risk of leaks later. 3. Keep your weight and posture in check. Extra weight puts pressure on the pelvic floor, and slouching can weaken core muscles. Light exercises like walking, yoga, and gentle core strengthening help reduce this pressure and improve pelvic support. 4. Stay hydrated, but smartly. Many women drink less water thinking it will stop leaks, but dehydration actually makes urine more concentrated, which irritates the bladder and worsens leakage. Drink plenty of water throughout the day and limit caffeine and alcohol, which can irritate the bladder. 5. Consider a medical checkup. If leaks continue despite exercises, a pelvic health specialist or urologist can offer treatments like physical therapy, vaginal estrogen creams, or minimally invasive procedures to strengthen the area. Early treatment is usually simple and very effective. Most importantly, don't ignore the signs. Leakage is common, but it's not something you have to just accept. Addressing it early will not only protect your hygiene and prevent odors, but also protect your independence, mobility, and emotional confidence for years to come. Part 4. Overusing harsh soaps, wipes, and scented products. One of the most common and most damaging bathroom habits among women over 60 is the overuse of harsh cleansing products like strong soaps, antibacterial washes, scented wipes, and fragrance powders in the intimate area. It often comes from a good place. Many older women worry about staying fresh and go the extra mile to clean themselves thoroughly after every bathroom visit. But here's the reality. These strong products can silently damage the body's natural defenses, especially as we age. After menopause, lower estrogen levels cause the skin, especially in the vulva and vaginal area, to become thinner, drier, and more fragile. The natural pH also becomes more alkaline. This means the skin is less able to defend against irritation, microtears, and infections. When harsh soaps or antibacterial cleansers are used daily, they strip away protective oils and disrupt the natural balance of good bacteria. Over time, this leads to dryness, itching, and burning sensations, tiny cracks or microtears in the skin, which allow bacteria to enter, increased risk of urinary tract infection, UTI, due to harmful bacteria spreading, contact dermatitis, an inflammatory reaction that can cause redness, swelling, and pain. Persistent odor issues, ironically caused by irritation and bacterial imbalance. Scented products are especially risky. Fragrances and preservatives in many wipes, soaps, and sprays are known irritants. They can trigger allergic reactions and chronic inflammation, particularly in thinner postmenopausal skin. And while using vaginal douches is far less common now, it's worth emphasizing, douching should never be used. It flushes out healthy bacteria, upsets the natural balance, and greatly increases infection risk, especially bacterial vaginosis and yeast infection. So how can women over 60 stay clean, fresh, and healthy without harming themselves. Here's what experts recommend. 1. Switch to gentle, unscented cleansers or plain warm water. Use a mild, pH-balanced soap or simply rinse with warm water for daily hygiene. Focus only on external areas. Never wash inside the vagina. The vagina is self-cleaning, and internal washing does more harm than good. 2. Pat dry gently, never rub. After bathing or using the bathroom, gently pat the skin dry with a soft towel instead of rubbing. This avoids micro tears that can happen in thinner, more delicate skin. 3. Skip daily wipes unless absolutely needed. If you use wipes, choose alcohol-free, fragrance-free ones designed for sensitive skin. Use them sparingly and follow with water cleansing when possible. 4. Moisturize the area regularly. Apply a thin layer of unscented, hypoallergenic moisturizer to the vulva, external area only, after bathing. This helps restore protective oils and keeps the skin supple. Some doctors also recommend vaginal estrogen creams or moisturizers for women with significant dryness. Ask your doctor if this may help. 5. Wear breathable cotton underwear and avoid tight clothing. Synthetic fabrics and tight underwear trap moisture, which encourages bacterial overgrowth and odor. Cotton allows the skin to breathe and stay dry. By replacing harsh products with gentler care, older women can prevent irritation, protect their skin barrier, and stop odor problems before they start. Remember, clean doesn't mean scrubbed raw. It means balanced, gentle, and healthy. This shift may feel strange at first, especially for those who've spent decades believing strong cleaning means better hygiene. But once you adopt these gentler habits, you'll notice less irritation, fewer infections, and more natural freshness, without the need for harsh chemicals or fragrances. Part 5. Ignoring subtle signs of pelvic floor or bladder problems. The final, and perhaps most quietly destructive, bathroom habit many women over 60 fall into is ignoring early warning signs of pelvic floor weakness or bladder problems. It's understandable. For decades, many women have been told that occasional leaks, urgency, or waking at night to urinate are just part of getting older. Because of this, they shrug off small symptoms, hoping they'll go away on their own. But here's the truth. Those little signs are often your body whispering that something needs attention before it turns into something far more serious. After menopause, lower estrogen levels and natural muscle loss affect the pelvic floor, the group of muscles that support the bladder, uterus, and bowel. When these muscles weaken, it can lead to urinary incontinence, bladder leaks, when coughing, sneezing, or laughing. Urge incontinence, a sudden, strong urge to urinate that's hard to control. Pelvic organ prolapse, when pelvic organs drop from their normal position and press on the vaginal walls. More frequent urinary tract infection, UTIs. Increased odor issues from trapped moisture or leaks. These problems rarely go away without help, and when ignored, they can gradually limit daily life. Women may start avoiding walks, travel, social gatherings, or even family events out of fear of leaks or needing a bathroom quickly. This isolation can quietly harm emotional health, fueling anxiety, depression, and loss of self-esteem. But here's the hopeful part. Pelvic floor and bladder issues are not something you have to just live with. With the right steps, most can be improved, often dramatically. Here are key habits that protect bladder and pelvic health well into your later years. 1. Practice daily Kegel exercises. Tighten your pelvic muscles as if stopping the flow of urine. Hold for 5 seconds, then relax for 5 seconds. Do this 10 to 15 times, 2 to 3 times per day. Kegels rebuild muscle strength and control, helping stop leaks and prolapse. 2. Stay hydrated, but smartly. Drink enough water to stay hydrated, around 6 to 8 cups a day, but avoid drinking large amounts all at once. Sip throughout the day. Too little water irritates the bladder lining and worsens odor, while too much at once increases urgency. 3. Limit bladder irritants. Reduce caffeine, alcohol, artificial sweeteners, and acidic foods like citrus or tomatoes, which can trigger urgency or irritation. This helps reduce leaks and discomfort. 4. Empty your bladder fully, but don't push or strain. Rushing can leave residual urine that breeds bacteria and causes infections. Sit comfortably, lean slightly forward, and relax until the flow stops naturally. Never force or push. Skipping daily gentle cleansing, especially after night sweats. And letting old towels and washcloths sit damp and unwashed. Each of these might seem small on its own, but over time, they stack up, and together, they can quietly erode your natural freshness. What's powerful, though, is that these are all within your control. You don't need expensive products or harsh chemicals. You just need consistency, mindfulness, and a little bit of self-love. Imagine walking into a room, knowing you're clean, fresh, and confident, not just covered up by perfume, but genuinely radiant from the inside out. That's the kind of presence people remember, respect, and admire at any age. So, starting today, choose one small change. Replace that old towel. Wash your undergarments more often. Let your skin breathe. Then build on it, step by step. Your body deserves that care, and you deserve the peace of mind that comes with it. Aging gracefully doesn't mean pretending you're still 30. It means embracing who you are now, fully, proudly, and beautifully, while giving your body the respect it has earned through all these years of carrying you. You've made it this far. You're stronger than you know. And smelling fresh, clean, and vibrant, that's just the icing on the cake.